Okay, good morning. Welcome to Smile Clinic, first of all.
Yes.
I'm Dr. Ahmedov. I'm a surgeon in charge for today's procedure. First on the floor, you'll be seeing her every once in a while, but this duo will be your main team for today. Paparazzi. Okay, so, and you started to notice your eyebrow problems a couple of years ago.
Maybe more last year.
More or less. You didn't have any microbleeding, no eyebrow tattoos or eyebrow removal. Okay, so let me draw it and we'll decide together.
Okay, no problem.
Eyebrow or facial hair restoration surgery has some tricky points. First of all, after we design the eyebrow, the rule number one is that we first of all frame or rebuild the general frame of the eyebrow. Do the implantation according to this one. Sometimes the patient asks us to design the eyebrow just the way they want to wear it. We're trying to explain to them that first of all it's better to rebuild the frame of the eyebrow so it fits their face, and if needed they do a small refinement or do the design of the eyebrow according to their personal expectations.
I think my eyebrows have always been thin since I was a teenager because I used to pluck them all off, but I significantly noticed that they were thinning last year, like very rapidly. So I decided that I try to find some alternative methods, like I used a lot of serums and things like that, but nothing worked. And because I do a lot of sports like martial arts, whenever I have makeup on, I would participate in the sports and they would all come off, and I would run to the bathroom because I would be so self-conscious and draw my eyebrows back in. So that's when I decided to do the eyebrow transplant. My operation was very smooth. The doctor was amazing and the team was wonderful. The only part that was painful was the anesthesia, but that was just for a moment. Otherwise, I didn't really feel anything.
Hello, our patients. Our eyebrow transplantation series it's the last part of the surgery is over, the implantation. So we did the full reconstruction of the left and the right eyebrow. The head, body, tail portions were fully reconstructed. Okay, we went with the remnants of the previous eyebrow of the patient. The only thing is that the right and the left eyebrows may seem slightly different. One side is slightly higher than the other one. It's normal because we have the natural right and the left facial asymmetry, so the eyebrows should be adjusted accordingly. When you look in the eyebrows, you can always see there is a small level difference, a small angle difference in both eyebrows. They should never be the same, otherwise it will not fit the face anatomy of the patient. So it's very important for us to meet this expectation as well. So the important point is the arch of the eye here and distance between the start point of the eyebrow and the mid-pupillary line here. So it should be very close to each other. Yes, it's slightly asymmetric but when we look in the total, it looks very like natural and organic. So it's very important to catch up the small differences. Also, one more thing, we always try to recreate the frame of the eyebrow, and if needed, the patient does more refinement or redesigns it according to his or her expectations. So the surgery is over. The total number of the grafts that were implanted was 237 on the right eyebrow, and 235 on the right eyebrow and 227 on the left eyebrow. But the number of the grafts we took from the back of the head is only 320. The multiple grafts were sliced into singlets and were implanted this way. So the actual implant number of the grafts is in total 235 plus 227. So all in all, we have something around 460 grafts implanted, but the number of the grafts we took is 320. So the surgery is over, the patient is happy, we are very happy. Now we'll be closely monitoring her for the results, and stay tuned for us.
If somebody is considering an eyebrow transplant, I would highly recommend Smile Clinic. The team and the doctor, they were just incredible. They made me feel very comfortable and everything went very smoothly. I was thinking to make my eyebrows extremely symmetrical, but after speaking with the doctor, he was saying that it's normal to have the eyebrows slightly asymmetrical, and that's normal for everybody. Follow the true transformation.